Good evening, I'm Dr. Akl. I'm a cancer treating doctor in Flint. Last time we talked about screening for cancer is important for cancer of the cervix and breast cancer for those above the age of 50 and colorectal cancer with occult blood in the stool. The end point of screening increased survival, and basically those patients who has been screened will get the benefit if they fall in those categories. Screening patients are entirely normal, no symptoms and no signs on examination, and those patients will benefit if they fall in those three cancers. That's totally different from diagnostic test, which patient go to doctor because they have symptom of pain, bleeding, cough, whatever symptom they have. Their doctor need to do some work up, and those symptoms do not necessarily mean cancer. We also mentioned that patients, if they diagnosed of cancer, they should not panic, and they need to undergo all diagnostic work up until staging is completed. Once that's done, then the options of their treatment need to be understood in terms of benefits versus side effects by their specialist. And the main three disciplines of radiation of cancer treatment is surgery, radiation, or chemo, or combination of those depending on the type of cancer and the stage of disease. Patients need to understand once their treatment is completed, they need to stop smoking and drinking. And I should mention to the all population in Flint, smoking and drinking contribute to approximately a third to half of cancers. Imagine if you stop smoking and drinking, third to half of cancers diagnosed will be prevented. So it's so important for those who do not have cancer not to smoke and drink, and for those who had cancer, they need to stop those as well, because second cancer could occur. Patients frequently have many questions when they come to radiation, and I briefly mentioned when patients seen initially in consultation, then go through the treatment, and they might experience early and delayed side effects. We said early means during the course of radiation, and in the skin it would be irritation, and that would be avoided by minimizing any irritant to skin, no sun, no hot water, and so on. Those side effects could occur inside the internal organs like small bowel or esophagus or stomach or the lung, and so on. The patients, once they pass the acute phase, which usually treated with medications, and the patient feel better, once their course of treatment is completed, they could have a second phase of side effects, which occur 6 months to many years, and that would be scarring and other side effects depending on the site. The good news is with technology advancement, these side effects or late side effects are minimum, and patients do not experience such side effects. Important points for patients to know and their family. They ask whether those patients after they finish daily radiation treatment, are they radioactive? The answer is no, because radiation is like having chest x-ray. Once you have it, you don't have any residual radioactivity. However, certain tumor treated with the radioactive material either swallowed, like thyroid cancer, we give them radioactive iodine. Those pills could be swallowed and they circulate in the blood, and yes, the patient has radioactivity, and those patients are isolated for certain area. For certain area and also for certain duration until this radioactivity completely eliminated from their bodies. However, the X-ray or the daily radiation with external beam radiation or temporarily high dose rate radiation, those are temporary. Only radiation go through the body during the treatment, and after the patient leave the room, there is no radiation and the patient is not radioactive. How radiation kill cancer? By damaging the DNA, double strand break in the DNA of the cancer cell, and those, once they divide, they die and disappear from the system. That's why if the patient experience big mass or big node, after a few weeks of radiation, this mass gradually shrink and disappear, and the results is very good. The normal tissue, if it has side effect, like in the skin might be erythematous and sometimes it peels. If that happens, new cells repopulate and fill the gap, and the patient become normal again. So the mechanism of action of radiation is targeting the double strand break in the DNA, and that eliminate cancer. Each cancer cell attempt to divide, they die and disappear from the system. Cancer, once we call it radiobiologically mitotic death, means cancer die in mitosis. Mitosis is the cell division. Radiation is highly effective in eliminating cancer, and it is a primary treatment in many cancers like head and neck, skin, eye tumor, tumor of the mediastinum, tumor of the pelvis, including female genital organs, male genital organs, and others. It is the main advantage of radiation is preservation of the function of the organ, like the voice box or external genitalia or internal organs. So you preserve the function of the organ, like the tongue. Radiation treatment to tongue cancer, eliminate cancer, patient keep the tongue so they could talk and taste. Those patients undergo surgery for laryngeal cancer, they lose the ability to speech normal way. There is a rehabilitated way for those patients with tracheostomy by having esophageal speech through certain period. So if patients pick the radiation, they need to understand the benefits, the side effects, and weigh the benefit. For example, in prostate cancer, main advantage of radiation, preservation of the prostate and less chance of impotence and no incontinence to urine. Also, you avoid major surgical procedure. I'll stop here and we will continue treatment of radiation to cancer.